Anatomy of the human orbit. Now, anatomy of the human orbit, of course, it's a quadrilateral pyramid in shape, just anterior to the equator, and posterior to the equator. They describe this as a truncated pyramid. Now, the volume of the orbit is around 29 mLs. Now we can talk about the margins of the orbit. It has got four margins. Superior margin, which is formed by the frontal bone, and the lateral margin is formed by zygomatic bone and frontal bone. Inferior margin is formed by the maxillary bone and the zygomatic bone. The medial margin is formed by the maxillary bone and frontal bone of the maxilla. Now coming to the roof is formed by the frontal bone and lesser wing of the sphenoid. And the lateral wall is formed by the zygomatic bone and greater wing of the sphenoid. Now floor is formed by three bones: maxillary bone, zygomatic bone, and the palatine bone. And the medial wall is actually formed by lacrimal bone, ethmoidal bone, sphenoidal bone, and just anterior to the lacrimal bone is by the frontal bone of the maxilla. Now that is basically the shape and description of the human orbit. Now, the weakest wall of the orbit is the floor because of the infraorbital sulcus or canal which carries the infraorbital nerve. At the same time, the medial wall also little weakest one. So these are the places usually affected by any trauma which involves the orbit. Lateral wall is the thickest and firmer than other walls.